Hola, bienvenido.
Gracias.
Yeah, we will try to talk English.
Yeah, no worries.
So, how can I help you? What's your name?
My name is Esteban.
Mm-hmm.
My problem is have a problem on my hip,
Mm-hmm.
on the muscle.
Mm-hmm.
I have been visiting 4 doctors, and at the end last year I got a surgery,
Mm-hmm.
a hip surgery. I have a prosthesis right now,
Mm-hmm.
but I am still having the same problem, and even worse.
So you went to 4 specialists
Yes.
to get a judgment of your problem.
Yes.
And after 4 specialists, you accepted the surgery, but you still have the problem.
Even more, even harder.
Okay. No, but this is, as I told the first patient, that when you look on an MRI, and then you can see some arthritis, you see some cartilage damage, and then of course, when you take that, what we learn in medical school on this person, it need to be a new hip because they don't check anything else. So, do you have any pain when you're walking? Constant pain, or?
I have a constant pain. I can walk perfectly well, but if I walk through a hard surface, then after half an hour, I have a big pain. Not if I'm walking in a soft surface like a golf course. I can play golf perfectly well, no problem. I'm also having problems at bed. I mean, sleeping. And probably if I'm sitting in a sofa for a long time, also having pains. But that's all. It's not a sport problem. It's walking on sitting.
The thing is that when you have this issue, when you're moving a lot, your blood circulation, adrenaline is releasing, and you don't feel pain. When you sit in the sofa or in your car, the muscle go to contraction and resting.
Driving is another big problem.
Then comes the pain.
Exactly.
So I will examine you after the nerve system, as I did with the patient before. I will probably go into your hip joint and feel how they did the surgery. And it can be very, very painful. So just enjoy the pain. But hopefully I find your problem so you will not have the pain afterwards, okay? But I need you to remove your trousers. So this we see quite often, actually, is that patients have a pain problem, and we are using the equipment we have, CAT scan, MRI, whatever, and we work after that. And because of the pressure in the hospitals that they need to fix things very fast, and of course that can create a problem also. If you lie down, sir, on your back, I'm gonna check your prosthesis a little bit. So just try to relax. Yeah, so this is typical prosthesis. Is there no pain here?
No.
Okay. Now comes the fun part. So I'm going to check everything that is associated to his hip joint, because if you still have the pain, because the hip replacement is actually quite easy surgery, is not specially advanced as a knee replacement. So I'm going to start up here, and I start very gently, and already here I can feel we have going to find issues. I'll start with psoas here. So that took a not so long time. So now when I find these swollenness here, and all the tendons associated up even to the abdominal muscle is severe on fire. This is very common. So if they just check this, it will probably save him from a lot of misery. No, this is better. So I go in between here, checking here. Still alive?
Right there.
And this one too. Yeah. So you can see every single muscle here is on fire. So of course, this patient will be definitely recommended to strengthen his muscles to support around it. And I can feel this. The muscles here is degenerated. It's like if you imagine cellulitis when you palpate it, it's wobbly, it's not constant, firm and nice, which is, of course, creating a severe issue. I check as the other, all the tendons here. So this is the hamstring. So this is, so it's not so weird that this guy have a lot of pain, because every main tendon, every main nerve is on fire. I check the ITB on the outside. This is not too bad. I see some bluish here, so I check that too. Check the lymph on the backside. Go in between. Boom. Yeah. So can you lie on this side, please? Here we can see the scar is a standard scar for hip replacement. Open up, remove, and just put the new one in, put it together. A little bit of super glue. No, it doesn't work. So I'm going to check the trochanter area here also.
You are approaching.
Yeah, I'm getting there, right?
Yeah.
So every muscle here is weak. So it's no what we call palpation resistance here. Check the, go deep into the piriformis here. Move my way down. So you see, I can gut in all the way to the prosthesis here and the joint area. Very, very easy without any kind of using any force. I go in between the muscles here to get all the way into the bone area. Here I even reach the sciatic nerve, but you can see I can play with it here like this. It's a very, very big nerve. It's very easy to find. That is good. Check the glute nerves here. The back side of the attachment. Okay. Can you lie on the back again? I'm going to check one thing that very few is actually observing when it comes to this kind of pain. It's the pelvic floor. I'm going to take a leg here. No, it's good. Okay. Yeah, congratulations to your new hip. So what we find here is actually a severe muscle, but I cannot see 100% what's inside. So I'm going to do a protocol where I actually follow the whole hip joint, and I'm going to do on the outside as well. And hopefully he will feel a lot less pain when I examine him again. I'm going to use the same devices. I'm going to also increase the blood circulation in this area. I didn't do it on the first patient because I want you guys to see the effect without using blood flow and nitric oxide. That is actually increasing the movement of nutrition, RBCs into the area. All of this you know. If you don't know, you know now. Okay, so I follow the hip line. So I put the positive here. If you already forgot his pain, I'm happy to demonstrate it again. It's like this. But he's a Spanish toro, so it's no problem. If he would be Swedish like me, I would run out. Now, don't be afraid to go into the depth. Everything can be examined. It's all about skills and technique, and we will train you to do this in detail. To even, if you go to the neurologic biochemical higher level education later, to feel even more or less every organ. And I put like only 3. I will put 4 positive here. You open your legs for me, like this. I'm going to use the negative. So this here, and I put the first one quite close to this one. If you lie on this side for me, please. Yeah. Thank you. So now I need to follow this line. I follow exact how the body is connected. and I try to hit this so it's go here. It's shooting through right now. So always think how you want the frequency to transport through your patient's body. Let me put the last one here. Okay. I'm going to have him do here because of this surgery here. I'm going to do like this one here. I put a positive here, a negative, negative here and negative here. And positive I'm going to put here and here. Now I'm going to use the AOS. So this one I'm going to use a little bit different. I'm going to use some on the front and some of the back. I'm going to put one here because it soft up the scar post-surgery. And this is amazing with these guys that if you have a patient post-surgery or you're going to do a rehab, that's fine. The quality of the rehab is massive. You can use devices to increase the muscle movement up to 53%. You can remove any kind of post-surgery pain, which means the patients you have can train better and you will get better results. I put ADL here, which is fantastic. I did a demonstration on a 2-week-old ankle joint replacement, and we applied the device. It was actually in Croatia. And he will start running around, walking around without his scratches after 2 weeks. And his orthopedic surgeon was there and watching. He said, "My God, what are you doing?" But this, imagine that when you have your patients and they can train properly without pain, you can remove the only thing that prevents them from doing a good rehabilitation is pain. And you can do that or give people back. This is the neurological anti-stress, and give them the life back. It's for me, that salary, this is why I choose this line of work. I'm going to have this one was here, anti-stress there. Okay, now I'm going to put the blood flow and nitric oxide. Where did I put them? Yes. I put them here. This is the device that increases the circulation, but the frequency of this is not only, it's also helping to contract muscle. So it's helping the muscle to contract easier and to move the blood better. So that's why it's called blood flow. So, and it's also creating the frequency to collaboration with heart and everything. So I follow the main aorta here on the back. So I go all the way up to the spine here, over the area with the blood flow. The nitric oxide, which is a gas that comes from enos. And this is the reason that we also can prevent any kind of stroke or anything. Because if we don't have nitric oxide, the vasodilation of vessels and veins will not perform as it should be doing. And that means they're getting calcificated thinner and thinner and thinner. The risk for cardiac issues is very, very big. It was one guy who got the Nobel Prize because he found out the influence of nitric oxide. And we have different strengths of this, and this is absolutely one of my favorite. And we always use all of them to make sure the patient always get the best. If you turn around, please. So I will do the same here. I will put the blood flow up here. And I put the nitric oxide down here. Then we wait 10 minutes. That is, in my world, going very fast. It's like 1, 2, 3, 10. And then I dig in again. And I find this injury here. So I'm going to now, just to show you the power of a low frequency, and when you have the ability to create fusion between cells, when I put my 104 kilo pressure on, what happens? Normally, he will probably be super scared, or you guys are scared that I will injure or break anything, but the body is so amazing. Of course, I know exactly what to do. So it was here. How is it now? This is the double pressure from before.
Well,
okay. Now it's 104 kilos.
Okay.
Yeah.
You are there.
Yeah. So we will check again.
No, really.
look at this difference now in the mobility from before. And even here, you have at least 10-15% better angle.
No.
Nothing? Nada.
Yeah.
So you can see now I can become a professional baker to do some bread on his side. And this is what is so amazing. Unfortunately, if my colleagues would have learned to use their hands to check all muscles before, because if this was the case, I didn't see his MRI, so maybe it was necessary, but if the pain is still there, if they would check this, and if they would have this tool, he would have a lot of different life. And this is need to be changed, as I said before, after 3 days, and then he need to drink water. All the time the patient go to the toilet, the urination should be clear, because we need the water. Every single device I apply demands a lot of resources. If the body goes out from resources, he can start to feel pain again. If you start increase the water, then the pain will go away. What many patients doesn't realize, when they had pain for a long time, when you remove the active inflammation, the muscle can start working normal, and it start to contract and testing itself all the time. It start to rebuild muscle mass. So a lot of patients comes to me and say, "Hey doc, the pain is much worse now." And I say, "Oh, is it the same pain or does it feel different?" "No, it's different, much worse." So they actually got training pain, because a chronic inflammatory muscle cannot work properly. So it cannot work, extend, and contract as it should be doing. When you remove the inflammation, it do that. It contracts and it start to work, create lactic acid and many other things it done for a long time, and give them a lot of training pain. And this is how ANF therapy works. I hope you like this. I want to show you a little bit of a sketch how this is working. How do you feel? Okay?
Very well.
It's good?
Very well.
Yeah, I will continue to fix you if you want. So thank you for coming, and don't forget water. Just make sure if we can prepare a change for him that he can change for himself, or if Helen can do it on Friday.